Medical errors in nursing. So we'll discuss the types of different types of medical errors. Prescribing errors. For example, selecting the wrong drug or the drug which your patient may be allergic to. Additionally, providing the drug in a wrong dose, wrong route, wrong form, quality, okay, quantity, etc. That are the examples of prescribing error. And omission errors, you forget to give a drug when you are supposed to give that drug. For example, some antacid was supposed to be given before food, you forgot that, and after food you got to continue other medication. So that is omission error. Wrong time error, the medication is given outside the predetermined time. It was supposed to be given in morning 8 o'clock, you gave around 11 o'clock or 12 o'clock, something like that. So that's a wrong time error. Then is improper dosing error. You either overdose your patient or you underdose the patient. So that is dosing error. Wrong dose error. Correct dosage was prescribed in prescription, it was correct, but while administering the medication, you yeah, overdosed or underdosed. Improper administration techniques error. Medication intravenously, like the medication which was supposed to be given orally, it was administered intravenously. Wrong drug preparation errors. The drug is prepared wrong, formulated wrong. Either you diluted it too much or concentrated. The concentration was more. Okay, so that is strong drug preparation error. Fragment care error. Lack of communication between the different healthcare practitioners had led to some medication errors. So, a specialist has prescribed some 5 mg of medication in their specialization, but while administering by the other prescription, it was given more than 5 mg, around 10 mg. So, that is fragment care error. Causes of medication errors. Distraction. A nurse who is distracted may read, for example, diazepam as uh, diltiazem. Okay, so it is sound alike, look alike kind of medication. So if not paid attention, you're not paying attention, you will be distracted. That may lead to medication errors. Environment. The nurse who is chronically overworked can make medication errors out of exhaustion and lack of proper lighting, heat, cold, etc. And other environmental factors. It may cause distraction and lead to errors. Lack of knowledge and understanding of the drug. You do not know much about the drug. In this case, try to do peer conversation, communicate with the doctors or the pharmacist, try to know more about the drug before administering it, know the mechanism of the drug before administering it. Incomplete patient information, lack of information about which medications a patient is allergic to, other medications the patient is taking which may interact with the action of two medications, okay, previous diagnosis of the patient, etc. So nurses who are not aware of these things should always ask the physician about before making any decisions. Memory lapses, forgets forgets to administer a drug for a given time, and this may be due to some overwork or overburden in the nursing arena. Systemic problems, for example, medications are not properly labeled. Medications with similar names are kept together, and kept in close proximity to each other. So this may lead to confusion and wrong dosage. So that is another example of causes of medication errors. Next, preventing medication errors. First thing, know the patient. Know the patient, cross-verify the patient's name, age, date of birth, weight, vital signs, barcode number, IP patient number, etc. before administering the medication. Know the drug. Learn about the drugs which you are not sure about. Learn about their mechanism of action, how they will interact with other drugs, in which all cases these drugs are contraindicated and indicated. So those knowledge has to be amped up. Keep the lines of communication open between all the physicians, nurses, or the other members of the healthcare team, etc. Situation, background assessment, and recommendation is done. For example, a situation is there, a patient is suffering from chest pain. And when you did the background check, the patient had undergone hip transplant replacement surgery, but he is having chest pain unrelated. So, while assessment, you check that the vitals, breathing increased, heart rate increased. the patient is facing this respiratory distress. You think that the patient may be in respiratory distress. So according to that, you will do the action. That is, immediately start administering oxygen and give him analgesic to relieve from chest pain. Okay, that's an example of doing situation background assessment and recommendation. Double check high alert medication. Always, for example, heparin and all. These are high alert health medications, blood thinners, etc. So the medication, especially which look alike, sound alike, can be a source of this errors. So always double check high alert medication before administering them. Document each drug administered. An accurate document is essential and should include accurate recording of the exact time, dose, route, how the patient name should be mentioned in the document when the drug is being administered. Take an active role in collecting issues. For example, if you see lookalike, sound-alike drugs are kept together in the rack, make an active decision to inform the ward in charge and change the places of lookalike, sound-alike drugs. So that's an example of taking an active role to check that medication errors don't take place. Inform the patient of the drugs they are receiving, so the patient can also stop you if you are about to make any medication errors. The patient should know what medication they are taking and this medication is for what particular condition. So such health education should be provided to the patients. Ask for continuing education. Always ask for continuous seminars, conferences about pharmacological names, new development in the pharmaceutical area about drugs, and new protocols that are being updated related to the pharmaceutical areas. Okay, ask for continuous education with your organization.